Ki khubor ka bate si TV. Lawan Rashapi taka Frank Motors. Booking open for the new Nexon. Visit Frank Motors or call 7045207973.
Shillong, it's been too long. It's Ronan Keating and I am coming back to India. Finally, I will see you there at the Cherry Blossom Festival, November 19.
The smile on your face lets me know that you need me. It's the way you make me feel. It's better than I've ever known.
Umintri rangba jangka jela u Conrad kongkel Sangma haka nyutrik unai wing aja arpulai ula Pyllait Paidbah eka Meghalaya mobile portable eye-based X-ray diagnostic facility hadim bla pli eka jingathirnya halo ka jingplait lu eka jingpang tuberculosis naki jela jangka niga than shate lamingi jangkari India. Hakani ka jingalang kublalong ha courtyard Marriott lasa khilang naka menteri ka koi ka khya jangka sarkar jila ka Dr. Amprin Lingdo bo Dr. Rudy Rico H. Ofrin ubla wan mikmat naka World Health Organization India u Dr. Rajendra P. Joshi naka DGB ka sarkar India u director jangka Nigrims u Dr. Nalin Mehta ki secretary ka tanat ka koi ka khya naka jila Nagaland bat Manipur bat QA.
It's a push for all of us to contribute to that end TB in India, TB Mukt Bharat as it is called, by 2025, 5 years ahead of the SDG goal to end TB. We have done a lot. As you can see on the screens around you, these represent all the videos, the films of the best practices around the state, whether it is the mobile X-ray and lab sample carrying around the Meghalaya. You also have the traditional healers being trained and engaged in active case finding here in Assam and Meghalaya. Integration of the national health program, integration of TB in the national health program. It's happening in Tripura. And of course, the impact of all your efforts in increasing active case finding. We have seen that the presumptive case numbers are really reaching highs all over the Northeast. So congratulations for all of that. I think it really deserves a big hand, and that's why we are having the summit, and it's something to celebrate and learn from each other. That's why we all meet together face to face. I think we have limits when we exchange information when we're doing everything virtually, but this time it's people to people, which will solve us and bring us to the end of TB. We are in our last miles, and this is what is needed. Diseases are not mutually exclusive. A pregnant mother may have TB, may have presumptive TB. An NCT patient who is hypertensive, or maybe more so if it's a diabetic, may have TB. So looking at the patient holistically is what we can leverage further from these investments in primary health care, primarily through the health and wellness centers. So we have to think about that, less of TB as a vertical, but as part of a whole health service that makes the community healthy. I would say the Health and Wellness Center is the caregiver of the community, and TB can be the lead point. If a community again is TB free, it will be an amazing contribution to the health of that person, that family, and that community. So that's one thing. It's really leveraging that. Doing opportunistic screenings. We should ask if someone is hypertensive, why don't, and a bit coughing, let's check for TB. Maybe you have a contact. We don't know. TB spreads so fast, and sometimes it's silent. Exchange our best practices. We'd be happy to support that. Maybe a follow-up with our district TB officers. What would be the next action points from this summit at the district level? We have to get down to that level if we really want to get to end TB 2025.
We need now to move ahead from this simplifying of the word tuberculosis. We need to provide for a robust preventive procedure, and we need to concertedly focus, continued focus to ensure that spread of tuberculosis is something which will happen on the ground. I personally come from a very urban constituency, and let me share with you that families have been wiped out completely due to tuberculosis in my own constituency, where healthcare is just an arm distance away. But our state has taken very, very positive steps to ensure that the preventive model is operationalized. And tuberculosis is a very, very high cost effective treatment, and we are so grateful that the Honorable Chief Minister has simplified the health scheme of the state of Meghalaya, and thousands of tuberculosis patients are now sincerely recipients of a cashless tuberculosis treatment. That's very important. We are handheld by a community participation where, our citizens in the 7,000 villages across the state of Meghalaya handhold tuberculosis patients. Like I said, nutritional inputs of diet for tuberculosis patients is an important key towards ensuring that patients are healthy and can fight the disease. And our communities located in various village health centers are now going to be the next level of people who will be there to handhold and ensure that tuberculosis eradication becomes a reality in the state of Meghalaya.
Healthcare has been one of the most important priorities for my government. In the last 6 years, we have continuously engaged and continuously invested in the health sector on various fronts. And today, we have one of the highest budgets in terms of percentage, in terms of the entire country, different states if you compare. Meghalaya has one of the highest, if not number one, number two, in terms of the percentage that we spend out of our budget on health. And that reflects the kind of commitment and seriousness that we have. While I say that, I would like to just reflect for a few minutes on the journey that we have had in the last 6 years and how things have unfolded for us. And I take this opportunity to share it because I feel there is a lot to learn. And I hope that these are kind of best practices in one way, not just for TB, but in general for the health sector as a whole. Where in the last 5 years, I had 4,500 self-help groups, but this information and this, the result or the problem that we could see encouraged me to increase the number of self-help groups today from 4,500 today in 5 years' time to 45,000 self-help groups in my state. There is one woman from every family today who is engaged in a self-help group. It's a huge milestone, and these women are today economically active. This led us to understand that we should come out with a program called Mother. A lot of people think mother is because it's a mother, but no, mother is Meghalaya's outcome and transformation, MOT, in health, education, rural development, and social welfare. We realize that if these 4 dots are not connected, we will not be able to find a holistic solution to our MMR problem. So this is what I strongly feel that is necessary for us to be able to do, whether it's MMR or it's TB. There needs to be detailed analysis, and every state, every district is different. Remember, there is no solution that is going to work across. You have to adapt the solutions to your needs. And Northeast is very complicated. It's very diverse. We have different practices, different beliefs, different culture, different terrain. And hence, we need to realize all this and ensure that we are able to find solutions by doing detailed analysis of what is the problem.